As a cardiology nurse practitioner, I get referrals a lot for abnormal EKGs. And so I thought to myself, you know what, self? This right here would make a very good lecture series. So let's do it. Without further ado, from the creative mind of Make It Make Sense Cardiology, I bring you this newest lecture series entitled Abnormal EKG, Am I Dying or Not? An Andrea Gibson production. And I am geeking out already because my brain wants to talk about this, has been wanting to talk about this for so long, and now I got time. I got time today. Today's teaching lesson is about early repolarization because without question, this is the most misinterpreted findings for a STEMI that cardiology comes across, and it's not your fault. It is not your fault, and thank you for consulting cardiology for this, but I'm gonna give you a little bit of insight. Clinicians, new graduate nurses, nursing students, those of you who are studying to become mid-levels, I'm going to give you some of the insights and bullet points so you can discern and differentiate ST segment elevation STEMI versus early repolarization. Woo! I'm so excited. Okay. On your EKG, your ST segment, that is a pivotal point for translation. And to make a very long story short, it is the moment in time when the heart, specifically the lower chambers of the heart, are going from squeeze mode, and they're actually actively, I told you I'm excited, calm down girl, they're going from squeeze mode, actively going into relaxation mode. That is what that ST segment represents. And it is vitally important that the heart goes from that squeeze mode to relaxation mode, because it is at that moment in time that the heart begins to fill with blood again, so that when it prepares for the next squeeze, it has an adequate amount of blood inside to give to the rest of the body. That is why the ST segment on the EKG is hands down the most important segment on the EKG you are going to find. Because if that ST segment is abnormal, that means that there is an abnormality in how well the heart muscle can relax, subsequently fill, and then give blood to the rest of the body. And we don't like that. We don't like that at all. Now, early repolarization changes are often misinterpreted for STEMI because they both come with elevation in that ST segment, but the elevation looks very different, STEMI versus early repol. In your ST segment, for a true STEMI, you are going to have a very flat ST segment elevation, looks like that, flat. With early repolarization, you are going to have a concave upward bend in your ST segment. STEMI, early repol. STEMI, early repol. Look at it on EKG. Y'all know if I had pictures, if I knew how to do all the pop-ups, I would do all that, but I don't know how to do all that, so this is what you get. With early repolarization, those changes could be indicative of an ischemic event, could be absolutely benign. Couple of factors matter. Very first factor that matters is context. Get a history from your patient. Is your patient symptomatic of anything that would be concerning for heart artery blockages, anginal symptoms, chest pain that comes with exertion, relieved with rest? Any sort of new onset activity intolerance, any sort of skipping, racing heartbeats that are worrisome to them? Have they had any fainting, syncopal episodes, any labored breathing? You know the spiel, clinicians. You know the risk factors for heart disease. Is there any uncontrolled diabetes involved? Do we have high blood pressure history? Are we a smoker? Sedentary lifestyle, obesity, any sort of sleep apnea component involved? Get your history, because clinical context matters when you are talking about ST segment changes, especially in the context of ST segment elevations. Now, if your patient has no symptoms whatsoever, they've been totally asymptomatic, this early repolarization or suspicion thereof is found on their EKG just as a happenstance finding. This can also be a very common variant in the younger demographic, and in the world of cardiology, younger, we're talking like under age 40. This is a very common finding in the younger demographic. It is very common in the athletic demographic. Very common. Early repolarization changes. Another key delineating point between early repol and STEMI. With a STEMI, with a true STEMI, you are going to have dynamic EKG changes by way of reciprocal ST segment depression in opposite leads, and you're not going to have that in early repolarization. So, take all of that into consideration. Wrapping things up, in an asymptomatic patient who just so happens to have these ST segment elevations, and you're still on the fence about whether or not something's going on with regard to ischemia versus not, get an echocardiogram, because that's what cardiology is going to do anyway. We're going to get an echocardiogram to look at the left ventricle wall motion. How is the left ventricle moving? Is the motion impaired in any way whatsoever? Is it sluggish on any side whatsoever? Because if it is, that's when you have a valid argument for lack of blood flow coming into that portion of the heart. If there's no abnormalities on echocardiogram whatsoever in an asymptomatic patient, and you have these early repolarization or even J-point elevation changes on an EKG, this is nothing worrisome. This is nothing worrisome whatsoever. Cardiology is still happy to do an evaluation, a consult, but just understand, in the absence of clinical symptoms that correlate to any problems, in the absence of structural compromise by way of echocardiogram, early repolarization changes on an EKG, not worrisome whatsoever. Was that helpful, or was that helpful? Oh, I'm excited I got all that out. I feel good. Okay, so much more in this series if you haven't checked it out. I've done posts on poor R wave progression, on possible left atrial enlargement, cannot rule out fill in the blank infarct, non-specific T wave abnormality, inverted T waves, like the whole nine. Lots of content, including from myself, about basic dysrhythmia interpretation. We all need that. Every last one of us who works in this field has started off as a novice clinician, and even before that, a student of our respective field. But how many of these content creators are teaching you about this stuff? This is the gold right here. Lots more to come. Stay tuned. But for now, class is dismissed.